Good evening to all of you. So today's class is going to be on research design. So the research design that I am going to talk today is actually divided into three groups here. Is divided into three groups. The first group I'm going to talk about is observational studies. Yeah, observational studies. So actually, what is research design? Basically, what is the method you're going to choose? Huh? What method are you going to choose? And remember here, the method that you choose here, some of it cannot stand alone. That means you cannot just do observational studies alone. Yeah? Observational studies, for example, yeah, as I told you, we have three breaking here. So the first one is observational study. So I'm going to talk about the observational study. So if you only want to use observational study, that means you're just going to use method. Yeah, the method you're just going to observe. The strength of the study is not so strong. So under our learning outcome for design is descriptive, analytical study. Yeah. Okay, so observational study. What is observational study? That is going to be my first design. The second design is going to be descriptive. The third one is going to be analytical. And the final one is going to be the RTC. So see how much can I cover here. All right. So under epistemology of the studies, we have experimental type and we have the non-experimental type. So what we mean by experimental? Experimental means you have intervention. That means you are doing some treatment. After the treatment, you're going to see whether there is an improvement or not. All right. So non-experimental, that is observational studies. Under observational studies, the one that I'm going to talk as the first design is it could be population based, it could be individual based. That means, for example, you are doing a research on a psychology aspect. For example, a patient with COVID-19, what kind of the observational, what kind of the psychology effects they undergo. Yeah. So it could be individual based or it could be a population based. So if you're doing a population based, it might be a health survey, yeah, under descriptive, or it could be an ecology study, which is analytical. And if you're doing an individual based of study, we can write it as a case report or case serial, yeah. And under individual, you can have a cross-sectional studies. Yeah, this is the three, yeah, case control study or cohort study. Yeah. Under experimental, you will have a randomized. This is quite important for clinical study. Yeah, randomized. We call it as randomized uh, clinic study or clinic trial. Yeah, RCT or non-randomized. Quasi-experiment such as field trip or community trial. So this is the epistemology of the studies. So now we are focusing on observational studies. Yeah, observational studies, you don't do any intervention, you just sit down and watch who your sample or your population. So it's generally done in a lot in social research technique, yeah, where you need to have direct observation, yeah, maybe with animal. And most of the time the observational research is under natural setting. So if you're going to study about gorilla, you need to go to the place where you can find gorilla. You cannot bring the gorilla to your lab, right? So it's done in the natural setting. Or you want to study about rumba haram, yeah, rumba haram. Or you want to study about transgender. So you have to go to the natural setting, yeah. So this differentiates the experimental research, which is quasi. Quasi is quite artificial, we call it, lah, because we try to control the variables. Here, when we do observational research, Normally we don't change the setting. If you want to see students who play truancy, ponting, yeah, you want to study about them, you need to go to the school, right? You cannot bring the student to find out that. All right. um, so what is the definition? So the intention of observing the consumer while they're interacting with their environment, yeah, without questioning and communicating. And sometimes they don't know that you are a researcher, you are part of the community. Yeah, I've tell you examples before. Yeah, they are part of the community. They want to there was a study, a person wants to study about transgender. So he wants to study about the transgender. You cannot go and question. Yeah, you don't go and question them why you became a transgender or what do you do here and all that. So you don't question them. So how you have to be part of them. There was a movie about a gorilla in the mist. The lady want to do observation about the gorilla, so she has to become more like a gorilla. But according to the document, the lady also became one of them and became too possessive of the gorilla. Finally, she was murdered, although she was a researcher. All right. So observation, we have two types here: naturalistic observation and participant observation. Two types here. So what is naturalistic? Naturalistic means you non-participant. You don't participate. You just observe. Yeah, observation has no intervention by the research. You just study the behavior that occur. Yeah, unlike the artificial environment, it's very typical limitation. Yeah, when you observe, you can't do much. Like it's a lot of limitation, a lot of restriction. Yeah. Um, all right. If a participant observation, in this participant observation, the researcher intervenes in the environment. That means inserting himself as a member. They become a part of the member like Mak Rempit, they become part of the member. So people don't know that they come to do research. They think they are part of their friend. Yeah. Or people who stay in the, what you call that, social homes. Yeah, social homes. We have a kitchen where people go and look for free food, right? So you become one of them. All right. So studies are type of observational research that involve a thorough descriptive analysis as a single individual or a group event. Yeah, both approaches here create new data, and we involve the analysis of data that already uh, exists. Yeah. So here are a lot of type of observation, which I'm not going to go one by one. Here, as y'all know, you should just have awareness that there are so many types of observation. Yeah. We have casual observation, casual, which is casual approach involve observing the right thing at the right place and also at the right time by a method of choice or by luck. Whereas a scientific observation involve the use of tools of measurement. Uh, you want to study about normally this one is done by biologists. Yeah, biologists, they want to study about a group of animals. Yeah, like elephant. Who is the head of the herd? Yeah, who becomes the herd? Who, how they choose the group? Yeah. So all these are observation. You cannot communicate with the animal, right? So it involves natural observation. No effort are made to bring any type of change in the behavior of the observed. You just observe, you don't go and advise, right? Subjective or objective observation. Immediate, this one involve the immediate experience, whereas the observation involve the observer as an entity, yeah, a part of being observed. And we also have direct and indirect observation. Yeah. Indirect is like you take a recording. That is indirect method. Yeah. Uh, right. So participant and non-participant observation. This is another type. All which one you're using depends on the nature of the study. Yeah, it's nature of the study. Okay, structured and unstructured. Structured observation means you make a plan. Yeah, you made a plan, involves specific information that are to be observed. That means you already have a plan. What are you going to observe today? For example, you want to go and observe a teacher teaching. So you must know, what am I going to observe today? Am I going to observe the teaching, the questioning technique? Or am I going to see the eye contact? Or am I going to see the content what she's going to teach? So this one, you already plan. Yeah. If unstructured means it's just the opposite lah. Yeah. Unstructured. Control and non-control observation. Control observation made under the influence of some external forces. Yeah. And it does not give you any improvement. Yeah. It's a control observation. Non-control observation are made in natural environment. You can reverse the control observation involving no influence or guidance. Yeah. All right. So we have observation method. We have 3 methods here. Control observation. Normally, it is carried in a laboratory type of situation where the variables are manipulated, is said to be in high control. Yeah. The weakness of this method is that it will be low in ecological validity. The study that you do, it's not so valid lah, compared to natural, because you already changed so people will tend to pretend. It's not a real one. Yeah. For example, you want to study about alcoholic. You want to study about the alcoholic. So if you control that observation, of course, yeah, they will be trying to be their best. So you can't get the correct valid data. Unless you want to study about alcoholic, you should go to the place where they go and drink. Or you want to study about drug users, drug addict, you have to go down to their setting. You cannot bring them to your setting. Yeah. All right. Natural observation is unstructured observation. Yeah. And the researchers simply record whatever they see. Then later they can see that again. Yeah. Compared with control and structured method, it's like the difference between studying wild animal in a zoo and studying them in the natural habitat. Most of the time you see the animal in the zoo, they are sleeping, right? But if you go to the natural habitat, when they are active, when they are sleeping, you can really study them, right? Because they don't hunt. When they are in the zoo, they don't have to hunt. So they have lost their natural skills, right? Strength, what is the strength of naturalistic observation? By able to observe the flow of the behavior. So this one, they have higher validity. You want to study about whale. You cannot put the whale in the aquarium and study the behavior of the whale. You have already changed the setting. So if you go to the ocean, you go diving, then only you can see the natural one. What is the limitation? These observations are often conducted on a micro, very small scale and may lack a representative sample. And then it will be biased towards age, gender, because you have a very small pool. Yeah. And this may result in finding lacking of ability to generalize. So you look at study about one whale, you cannot generalize about the behavior of all the whales that you find in the ocean, right? Same like you study about a group of drug addicts, you cannot generalize. So natural observation are less reliable. So how much can you observe? Correct. As other variables are not controlled. This makes difficult for another researcher to repeat the study in the exact way. All right. So a further disadvantage is that the researcher needs to be trained. So when you observe, you must know what the observation shows. So you cannot simply go and observe, then you say, I never see anything. Because it's not, it's written black and white. It's not written black and white. It's all hidden. So you have to be able to interpret it, of a situation that is psychologically significant and further attention. Just like you see a dental patient. If I look at a dental patient, it does not click anything when the person say, I am having a pain. So when there is a person who have experience like you have studied about that, then you look at the patient, you will know what to look out for. Correct or not? You know where to check. right? So another one is participant observation. Um, this time you have a participant. You have a participant observation. It's a variant of the above, but there is a researcher joins in and become part of the group. They are studying to get a deeper insight. So if you're an outsider, people might not tell you all the secrets they have. So you have to be part of them. Yeah, you have to stay with them. You have to be with them. So participant observation can be either cover or overt. Yeah. All right, undercover lah, more like undercover, or takes a false identity. You are not a transgender, but you become like one. It's false identity. Yeah, or a police officer, he becomes somebody else because he wants to find out about the case, right? So it can be difficult lah, limitation to get time, privacy for recording. So if you become part of them, you cannot go and record. He will ask, why are you recording? Isn't it? So that will be the limitation. Yeah. And with convert observation, researcher can't take notes openly. That means you cannot write down. Or after seeing, you cannot write down. So this means that they have to wait until they become alone. And then they have to depend on their memory. On the memory. So this is a problem that small details you might forget, or you cannot remember. Even you're talking to them, what is the conversation about, you cannot do it back again, right? So sometimes the researcher becomes too involved. That means he will start seeing, interpreting everything according to what he wants, what he or she wants. Yeah. So it will also, they might lose their objectivity and become biased. And this is always the danger, that we will see what we expect, what we want to see, we will see. This is a problem, that they could be selectively reporting information. So the negative part they never report because they are doing a study on that. So if it's like that, normally observation, the factor there is normally bias and also not valid. Yeah, not valid. All right, pro and cons of observational study. Observation allows you to see how individuals act together and separately. If you take bullying, now the latest issue is bullying in school. When they are alone, they are they are not what they seems to be. But when they have a group, when they form a group, then only you can see their behavior is different. So these observational studies will help that in that way. Observation allows you to create or observe actual situation instead of using data to try and predict the behavior. So it's all in front of you. Yeah. Observation can improve the quality of the behavior analysis based on the demographic, therefore increase the validity of the research. This technique is ideal for non-verbal communication where you cannot talk, like especially with animals. With animals, so it can help you to produce a individual profile. And observation provide a more reliable measurement of the actual behavior than you ask a person to report. For example, moral studies. Moral studies, uh, if you study about moral studies or psychology studies, normally you give them questionnaire. So when you give questionnaire, the participants are not all honest. They will write what they think is correct. That's why moral paper, exam paper, which is not the correct way to measure how high the morality of the student. Yeah, because it's all self-reported. All right. Cons, observation research can include a high degree of researcher bias, because observer, we are also human. Yeah. And subconscious opinion on demographic can affect the analysis. The method also relies on the interpretation of the observation. Actually, the person means something else, but from your observation, you made the wrong conclusion. Yeah. And observation only tells one part of the story. So attitude and opinion cannot be clearly expressed through action. So it may not be clearest picture possible. So that is um, part of the cons. Yeah, the behavior and physical personal characteristic can be examined. The researcher does not learn about the motive, just like a murder case. Yeah, by observing, you wouldn't know. Yeah, you wouldn't know what is the motive of the murder by looking at the position of the victim. Yeah. So the attitude or intention or feelings you cannot look. Observation research can be time consuming and costly if the observed behavior occur rather infrequently. That means maybe you go there one day, you didn't see anything. You waited 1 week, you didn't see anything. You keep on going. Yeah, keep on going. Then 3 months, there's no observation. So it will be really time consuming. Yeah, but now with the aid of technology, with the camera and all that, it makes life much easier. Yeah, interpretation of data can be a problem, and also invading people's privacy. All right, so the conclusion for observational research is a descriptive research that differs from most other form of data gathering. In the researcher goal is not manipulated. So now you just observe only. So not much things can be done. Yeah. Um, while the participants may or may not be aware of the researcher whether they are around present or not, and the researcher cannot control the variables. Yeah, right. So that is the first design that I want to discuss, observation. To me, I like this observation design because it is interesting. Yeah, to me it is interesting. Yeah. All right. So now I'm looking at the second research, which is analytical studies. Yeah, analytical studies under cohort and case control study. All right, so I'm bringing this again. Where this study come in, cohort study. Yeah, cohort study, case control study. Yeah, is under descriptive. Yeah, is under this place, descriptive. Yeah, and then you have case control study and cohort study. They come under individual base and they are non-experimental. Non-experimental means you don't do any treatment. If you are doing treatment, it comes under experiment. Yeah, experiment. Under experiment, you have random and non-random. But under non-experimental, we don't use the term whether random or non-random. Yeah, all right. So this guide was created to introduce to the following study, which is frequently used in health sciences. You all come under health sciences, yeah? So here we are going to look at cohort. We can see cohort, we can see clinical trials, we can see randomized control trial, case control, systematic reviews, yeah? Um, so here I'm going to actually I try to make it as simple as possible. Yeah, not to bore you lah. At least you just get a clear picture that we have so many types of research design. But from my experience, most of you will end up doing a survey. Yeah, some will come up with intervention, experiment. Yeah, okay, it's up to you lah. But I think next week I will be meeting you. Yeah, I will be doing the class on Thursday, 8 o'clock morning. Yeah, on Thursday I'll be meeting all of you in the Google Meet. Yeah, we'll be having class face to face. So what I mean face to face online lah. Yeah. All right. So what is cohort? A group of people who share a common characteristics, experience within a defined time period. Maybe they belong to the same age, or maybe they belong to the same occupation. Maybe if you are in all of you are in year 3, you all are in the same age group, right? So you're called as one cohort. Maybe you can do a comparative study between cohort 3, cohort 4, cohort 5, yeah? Or cohort also exposed to drug vaccine, or a group of people who are all undergoing pregnancy, or insert person. Why do you choose a cohort study? Okay, so it's a good evidence. You want to show that when people are exposed, when they're exposed to certain kind of disease or what, and the outcome shown by descriptive and case control study. So the exposure is rare, the incident is high, when attrition of people can be minimized. Attrition means dropout. When you start a study, you have a lot of people. Then after slowly, people are dropping out. They don't want to get involved in the study. This is when a cohort study you can use. And you have a lot of money. For the study. So in a hierarchy, if you look at the which one is the best. Here we cannot make a general statement which is best. Depends on what you are studying on. But if you put a cohort, and cohort study and case control study, they are at a higher rank. And RCT, randomized clinical trial is better, right? The bottom one all is not so. The evidence is not so strong. All right. So how do you differentiate a cohort study? You have a group that is exposed and one group is not exposed. So what are they exposed to? Disease. When they're exposed, one person will get the disease, one person does not develop the disease. And then another one, not exposed at all. They were not exposed, but they have the disease. And of course, they do not have disease. So you have two groups here. One exposed, one not exposed. For example, you have this I'm just telling you, year 1 and year 5. Of course, year 1, they are not exposed to clinical classes. They don't go to the dental clinic, for example. So, of course, the exposure is different. So, one is exposed, year 5 is exposed, year 1 is not exposed. So, you already have two different cohorts. Right? So from there, you can just bring it down some more. Disease. Maybe what kind of skill they study, what kind of skill they don't study. Right? So this is what happens. Healthy people. So when healthy people, you expose them. What happened? Exposed and unexposed. You have two groups. And then you have disease occurred. And then you have non-disease occurred. This is the example, of a cohort study. So exposed, they will have result. They do not have any result. For example, COVID exposed, both group, one exposed, one got the COVID disease, and then another person did not get the COVID. And then these people were not exposed at all. They also might get, and another group might not get. So this is an example of a cohort study. So they are identified prior to appearance of disease under investigation. So you get the cohort before any problem. They don't have any problem. So study groups are observed over a period of time to determine the frequency of the disease among them, and the study proceeds towards from cause to effect. A very good example is your COVID-19. All right. So the key element of a cohort study is the time factor. So following the exposed and unexposed group over a time, cohort study are uniquely equipped and described process and mechanism by which expose rate to the development of disease. So if you are going to study about diseases, cohort study is a very good study. It's a primary tool to study time and medicine. So under this cohort study, the focus is a time frame. You can study the time and the medicine. If you're studying about antibiotic or you're studying about painkiller. So they provide the data to describe when the disease occur and track their consequences over time. So how bad or how much it improved over time. So factors that cause disease or early sign of the disease can be monitored over time. So this one give you a lot of idea or picture of what the disease is going on over time. So diversity of the individual in cohort study provides the data to identify the risk factor that makes the individual more susceptible, yeah, how much they are exposed. Right. Through this study also, they can find out where the disease occur and to what extent the disease can spread over different location. So a cohort study with adequate sample and follow-up enable us to understand the natural history of disease. So once you get the measurement of frequency of the disease, how it is adopted, then it will tell you lah, how many times higher or lower the risk between the exposed and unexposed. Yeah, and also you can find the difference in the risk. So it's an attributable risk or relative risk. So these are the advantage of doing a cohort study. So this relative risk will give you a causal relationship between the disease. So when the person have disease, how long does it take? Yeah, how much exposure will bring the disease? All right. Any disease associated with your dental, yeah, your dental clinic, so you can do a time frame. How long? Then you get the disease. All right. So or exposure, not necessarily disease. How long you are exposed to practical skills will give you a high performance in your skills. You can compare in that way, right? Compare year three and year five. Maybe year five they have exposed more exposed, or psychology effect. Where a student from year three and year five, you can compare, right? Not necessary disease, any other thing, like psychology. Okay, here mostly are given on health reason because this slide is more on health sciences. Yeah, so lung cancer and smoking. So what the result? Prevention: avoid cigarettes. Unprotected sex and HIV. So we avoid unprotected sex. IV drug use and HIV. So we avoid IV drug use. Yeah, right. To prevent heart disease, avoid high LDL, high dilipid density, right? High density lipid and low HDL level. So we have to prevent. So to prevent heart disease, we must avoid LDL. To prevent cancer, cervix cancer, all right. So you have to avoid infection. So we know what are the prevention strategies. When you choose the cohort, they must be free from the disease under study, and both study group and the control group, yeah, should be equally exposed to the disease under study, and all the other variants should be constant. Yeah. So you must have the selection of the subject. Yeah, the selection here, the general population. Yeah, general population you can get from this general population. For example, expose of death is frequent in general population. Is it depends on the geographical or political whatever lah. Yeah, that is the general population. Then from there you have special group, maybe doctors, maybe nurses. They are the selected groups. Yeah, and you have the exposed groups. So when you are exposed, these people are exposed to chemical agent. For example, this group of people are staying in the same area, but one group will be drinking normal water from pipe. Yeah, another group might be drinking only the filter water. So you have one group not exposed, one group already exposed. Yeah, then it will be a cohort study. So the cohort member, how you obtain the data, you can do interview, you can do questionnaire, yeah, a view of the record, the dose of radiation, Maybe the person living very near. Okay, there's one example. If you have a house very near to the electrical pole, and you have another population staying near a riverside. So these two group, one group is exposed to the electric, what you call that, current panels. So here you can see the dose of radiation. Yeah, or if you're doing surgery, this surgery, during surgery, one group was given local anesthetic, one group was given general anesthetic. So you can view their records. Here all depends lah what you are doing. Or you want to look at the blood test. This is how you're getting your data, your X-ray, your cholesterol, ECG. Here all are given for medical, medical. Maybe for you have X-ray of the tooth, the length of the tooth. You have your own criteria here. Or environmental study. This one is given a very general one. Right, and then you can do a comparison group. Then you can do a follow-up. Follow-up, how do you collect your questionnaire, right? Maybe you can get it through phone call, home visit, review the records. All right. So we by the follow-up, we can get 90%. We can get back the data. Okay. So what is the advantage of cohort study? I just go through here generally. When you are going to use this kind of research, then you can refer, right? I just tell you generally because a lot of topics are given, but my time is only 10 hours with you, so I can't really go very detailed. So advantage here, we can minimize the biasness. Biasness. And another thing, we can also calculate the ratios. Disadvantage involve a lot of people, and then takes long time to conduct the study, and also you might also require a lot of record keeping and dropouts, and selection of comparison group is difficult, is expensive, and the study may alter the participant behavior, and also you have ethical problem. Right. So here we can see that there is a difference lah. Cohort, you have large number of sample, but in case control you have fewer subjects. And then it's cheaper lah for case control. So we see what is case control. So case control, you have seen a few patients with certain type of cancer. Imagine you are a clinician, and then almost all of them are exposed to the particular chemical. So your hypothesis is that their exposure is related to the risk of developing this type of cancer. So for example, certain medicine will develop rashes among your patients. Cannot be your medication give you cancer, cannot, right? This one you are doing a study, rashes. More people are allergic to this kind of antibiotic, for example. So how do you go about confirming or refuting your hypothesis? So your hypothesis is antibiotic A does not cause any rashes among patients. Then I have another hypothesis, null hypothesis, and alternative hypothesis. Antibiotic A causes rashes among patients. So now I need to do a study to confirm whether my null hypothesis is correct or not. So we can do a case control study. So here the researcher starts to pick up cases who already develop particular disease. Okay, here what will be rashes or outcome of the interest of the comparison group who have not developed the disease. Okay, here rashes. So you have one group got rashes, one group got no rashes. So she's trying to find out the presence of particular exposure and what is the risk factor, and compares the two groups in regard to the presence of history of exposure. So the person got rashes. How long was he taking the antibiotic? Another group, how long was he taking the antibiotic but no rashes? So you can do a control case study. So a person with population or study identify having a particular rashes. That is the case. The control group is not having the rashes. So you have two groups here, case and control. Right? Features of case control study, both exposure and outcome has happened before the start of study. Correct or not? This is the case control. You already given the antibiotic, you don't know, it's not done with purpose. They already developed the rashes, right? So the study proceed backward from the effect to the cause. So it uses a comparison group to support or to refute inference. That means the person got the rashes maybe not because of the antibiotic, because maybe or because of the food, because of the cleanliness. Could be so many reasons. Yeah. So you try to show it what is the real case. So like we have with disease and without disease. Exposed, how many A? Without disease, how many? That's B. Not exposed, C. With disease, without disease is D. So total A and C are all with disease. B and D is without disease. So from here I can find out the percentage. Yeah. So where are you going to get your groups? Here you no choice lah. You have to get it from your PIDC patients. Yeah. So it can be hospital, relative. But here your research you're doing mainly with your patients. Yeah. So it's hospital based lah. Yours will be hospital based. Yeah. All right. So what is the advantage? Easily identified because they come to your clinic, available for interview. You can talk to them, ask them. They are more willing to cooperate because they are having the problem. Yeah, tend to give complete and accurate information. So less chances to get bias kind of report. Disadvantage, not typical of general population. That means you cannot get so many people with that kind of rashes, isn't it? So it is not possible lah. Yeah, not possible. But there is a certain type of biasness. Yeah, Bergsonian biasness. You will see that. What is that? I also Google and find out that. All right, and then population base. They are from general population. Yeah. So yours one is the hospital base. Yeah. Okay. So how many control group? You can use 1 to 1, you can use 1 to 2, you can use 1 to 3, you can use 1 to 4, or you can have multiple, no problem. Yeah. Okay. So like here, this is how the design. You have children with brain tumor. So radiation causes cancer. That is null hypothesis. Your alternative hypothesis, radiation causes brain cancer only. So we have groups here. Children with other cancer, children without cancer. So this is your design. Right? So how you're going to, you can do interview, you can do questionnaires, you can look at their past records. So analyze, you expose rate. You can find the rate and you can find the ratio. Like here, you see, you can find the percentage. Cases with lung cancer, smoker and non-smoker, total 35. Control, smoker and non-smoker, but they do not have cancer, lung cancer. Right. So the total sample is 117, with cancer and without cancer. So I can find out the cases, how many percent, control, how many percent. Then I can make a conclusion. The frequency of smoking is definitely higher among lung cancer patients than those without cancer. So this is an interesting case control study. I also can find out about the ratio. Yeah, ratio. So the ratio here is 8 to 1, 8.1. 8 to 1. Yeah, that means the odds of smoking more than 5 cigarettes per day is 8.1 times higher in lung cancer without lung cancer. So those who smoke 5 cigarettes, they have the tendency to get lung cancer 8 times more. Yeah. Or smoking more than 5 per day was found to be associated 8.1 times more in patient with lung cancer. So we can say with confidence that if you are a smoker, there are higher risks of getting lung cancer. What is the risk? 8.1 times higher. So it's an interesting study. Yeah. So bias, of course, all the studies will have bias. So these are the Berkeson bias. They are negatively correlated. Okay, these are all later lah. Yeah, you'll be studying about this. So this is the third one about our topic today. So I have studied this topic. I've discussed with you. So we go back to our objective of today's class. I have covered a lot observational studies. Yeah, I have studied. I have already discussed analytical, right? Cohort and case control, correct? So I have done observational study and analytical study. So I still have descriptive and RTC. Okay. These two I will discuss the next hour. The next hour. If I can, I will put up another recording on these two. So when I meet you again, I will be talking about sampling techniques. Yeah. So next Thursday, 8 o'clock, we'll meet again to discuss on sampling technique. The other two of research design, I will do the video recording and then I will upload in the Google Classroom. So you can just look at it, right? Okay, so that's all for today. Happy learning and happy looking at my slides. And if you have any feedback on how to improve on my presentation, all of you are welcome, yeah, to let me know. If you prefer another way of teaching or what, you can always get back to me, right? So I think that's all for today's class. And have a nice day. Okay, goodbye everyone.